So I've wanted to be a veterinarian since I was about 5 years old. Well, realistically, I remember since I was about 5 years old, but I'm pretty sure somehow being a vet was in my blood. And I scrubbed into my first surgery when I was 12. I actually went on my first farm call when I was 13. Mind you, I'm pretty sure when I first started, I really thought being a vet was about playing with puppies and kittens. Boy, was I wrong. I've learned a lot since then, and one of the biggest things I've learned as a surgeon is the fact that we have so much information and so much knowledge, but there's so many things that we don't know, and there's so many things that we really can't control. And so, as I've gone through my career, and as I've considered things further, I became a surgical oncologist to try and understand how cancer worked better, and understand how I could work with both animals and with humans in treating cancer. And so the big thing in being a surgical oncologist, and the hardest part of my job, is often people come to me with a pet that has a pretty big tumor that they watched growing for quite a long time, and ultimately now they're coming to me because the animal is suffering, not doing well, or it's really causing a lot of discomfort or challenges with them. And so it becomes my job to figure out, what can I do for this patient, but also while considering, how can I do it in a way that's going to really improve their quality of life and minimize their suffering? One of the biggest challenges in medicine in general is that, unfortunately, as a human, we're really limited in what we can do. And so it can be really challenging sometimes to know when we have these patients come through the door, what are our options? And I've been presented so many times with a patient that I see them and I'm like, you know what? I don't think there's anything I can offer. But sometimes I wonder, is it that I don't know what I can do? Is it that it's what I've learned and it goes beyond what I understand? Or is there actually options and it's just not something I have thought of or anyone's really thought of before? And this can really be the key. Now, don't get me wrong. I am a huge proponent of just because we can doesn't mean we should. It's extremely important to me that everything I do when I consider my work is about quality of life. But what about if we could prolong quality of life and quantity of life? And this is where I'd like to argue that maybe 3D printing can really revolutionize the way that we practice medicine. I'd like to introduce you to Patches. I'm sure her owners had no idea when they gave her that name how fitting it would be in her future. So Patches originally presented to me when she looked like this. But her owners had noticed a very small mass growing year over year, and it actually was there for about 3 to 4 years. And they initially went to their vet when it was really tiny, and their vet looked at it and said, you know, I'm really sorry. This is something really bad. It's probably cancer. There's nothing we can do, and it's going to kill her eventually. Well, the mass kept growing, and it kept growing, and it kept growing, but Patches was doing great. And so her owners decided at that point that they wanted to dig a little deeper. And so that's how I met Patches. Well, by the time I met Patches, this is how big her mass was. So it was no longer this teeny tiny little mass that was a bump on her forehead. It was obviously a lot bigger and a lot more significant than that. And so when I met Patches and took a peek at her CAT scan, I was feeling optimistic that there might be something we can do, but I knew regardless of what we did, it was going to make a really big hole. So lucky for Patches, my colleagues and I at the university were actually working on some research that were considering cases just like her. And so we had worked on figuring out how we could print a 3D plate that would allow us to reconstruct this defect. So when we took a case like Patches and we ended up with a very large hole, we would have options. So in Patches' case, and other cases that come to us, it all starts with a CAT scan or a CT scan. And so if you take a look at the image on the left, that is what we could see in Patches' case. And amazingly, that tumor was massive, but it was growing very slowly. And it was producing a lot of tissue, very much like bone. And as it progressed, most of it was growing outward. But there was a little bit that was growing inward as well. And so by the time that we took a peek at her CAT scan, the tumor was about the size of a baseball, give or take. It was pressing on her eye socket, it was pressing on her brain, and it was encompassing about 70% of the top of her skull. And so, looking at her CAT scan, I knew that we were going to have to figure out something a little more than what we would do traditionally in surgery. And so this is where our 3D printer came in, and I started by sending off her images to have them printed by a 3D printer. And ultimately then, what I ended up was with this. This is patches in 3D form, tumor and all. And so this is exactly what her skull looked like underneath the skin. And so by holding this model in my hand, I was able to take a look and understand exactly what was going on in patches. It really helped me to understand how I was going to approach this case. Once I used that CAT scan and did all of that planning, it also helped me to understand what was going to come next. And so at the end of the day, I knew that after I did surgery, I was going to end up with a hole like this. That is a lot of brain exposed. I knew that going in, but I don't think I could really appreciate how much of the brain I was going to see until we actually got as far as printing this model and removing that tumor. And so the first step in that battle was figuring out that hole. But then from there, we had to figure out what we were going to do about it and how we were going to do anything further. And so that's where 3D printing came in again. So as I showed you on that last screen, we started with that CAT scan. Now, a CAT scan allows me to take that image, process that three-dimensional image on a two-dimensional screen to understand better what's going on. So we take that picture, and we have slices and slices, and it allows us to see exactly where the tumor goes, what it's involving, what structures are involved, and also to plan and understand what that margin is that we're going to have to remove in order to try and prevent that tumor from coming back. So evaluating that whole area, ultimately, we could identify the corridor of where that tumor was. From there, we were able to translate that into a digital model that reprocessed it into 3D. So we start with patches in 3D, we take a CAT scan and we turn that back into a two-dimensional image, we put that up on the screen, and then we switch it back over into a three-dimensional image, but we're still on that two-dimensional screen. And so that makes it really hard to plan exactly how we're going to approach things. And so we need to use that combination of the model with the digital planning and figure out exactly what that margin is going to be. Once we perform that virtual surgery, we can actually see on the computer screen, as well as in real life, what the defect is going to look like. And so you can see on that bottom image there, this isn't patches obviously on this screen, but it's exactly the same situation as what we started with. So we're going to start with having that virtual surgery planned all before we hit the OR. From there, this is actually surprisingly the easy part. We have a really amazing human software that allows us to do some planning to create that plate. And so the plate we have to figure out what the diameters are going to be, we have to figure out how thick it's going to be, how many holes we're going to put in there. But ultimately, all of that information we can gather and then send it off to our 3D printer. The image on the left is what we get out of the printer. So we take everything, we send it off to the printer, and the way that the 3D printer works is it actually lays down, somewhat like a laser printer, layer by layer, until you create a three-dimensional object. So think about your traditional printer. You can print one sheet in a pretty short period of time. It takes a little bit longer when you're talking thousands and thousands of layers, but amazingly, this whole process can still be done in a fairly short period of time. And so we start with that metal object. We have all of those structures attached to it, and all of that has to be processed off in order to make an actual plate that exists and it can be used in a medical situation. And so once all of that is processed, then we end up with a plate. And so this is actually the exact plate that Patches had. So the entire process of planning took around 2 to 3 weeks. And at the end of the day, we had a plate and we had a model. And the amazing part was that plate fit perfectly on that model. So just like a glove. The problem then becomes, though, how do I make sure when I do surgery in patches that my hole is exactly the same? Because if this hole doesn't match this plate, then all of this work is for nothing. Well, not completely for nothing, because in Patch's case, we would still remove the tumor. But ultimately, it would be a lot more challenging. And so that's where we have to go to the next step and go back to our 3D printer. And so we actually use a printing guide and create a template, so that in Patch's case, we could actually take it right into the OR, place that template on her skull, use that to trace out exactly where the margins of what we're going to remove are, and then we end up with a hole in Patch's skull that looks exactly like the hole in this model. So this is Patch's. So as I said, planning took about 3 weeks, and then we went in and had surgery as Patch's had surgery not too long afterwards. And so surgery went very well. The surgery itself was quite challenging and took multiple hours to be able to get through it. It was difficult. There was a lot of challenging corridors and areas that we had to get around. We wanted to save the eye, which was an important thing for her owner. And so ultimately, when we finished the surgery, the best part is that we were able to take that plate, place it on, attach it with a few small screws, and she was awake in a very short period of time. Amazingly, that video on the left is actually Patch's about 6 hours after surgery. And so she did incredibly well, and she recovered very, very well, and she was out for a walk, trying to eat garbage off the floor, and being her usual silly self very quickly. The image in the middle is actually Patch's at about 2 weeks after surgery, and so right before we took her stitches out. And so she doesn't look perfect, but I'd argue that she looks pretty good, considering, certainly a lot better than she did before she had surgery. And then the final image on the right is actually of Patch's in her Wonder Woman costume at Halloween. So as you would guess, in a case like Patch's, she obviously has an incredibly dedicated and really, really special family who cares a lot about her. And they actually started calling her Titanium Top after she had surgery. So she's a very important part of the family. So what does 3D printing mean for the future of surgery? Well, this is actually a procedure that is being used in humans as well. But one of the challenges, as you heard earlier, is it takes a long time to adopt new technologies and new treatments within human surgery. There's a lot of regulatory hoops to jump through. There's a lot of things that really delay the entire process. And so while it's being done, it hasn't become mainstream, and it's not being done that frequently. And so in the meantime, while we're working on improving that regulatory process, we can continue to collect a lot of valuable information from our animal patients while providing them with incredible care. And so our goal at the end of the day is to make sure that we can really aim to collect as much information so that 3D printing in medicine can become something that's very evidence-based and is done with as much care as possible. Because really anybody can buy a 3D printer. They're available on eBay probably for $200. But we really want to make sure that this is done in a really careful and scientific way, and that we really understand any of the potential risks, concerns, or complications that can come along with them. So Patch's is a great example of how we can use 3D printing in medicine, but really she's just the beginning. So there are no limits beyond what we can imagine. It's absolutely incredible the things that we can accomplish. There's been some work done from very simple preoperative planning to intraoperative plates to everything in between. Really, our goal at the end of the day is to personalize medicine, to allow us, instead of taking that implant off the shelf and having to modify it to the patient, to instead be able to actually plan everything in advance, create an implant that is perfectly designed for that individual patient, and then use it in the OR so that we can decrease the amount of time we spend, improve their outcomes, and really improve their overall success rate with surgery and in medicine in general. Thank you.